Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Welcome to the show. We meet here every Saturday at 10:30 a.m. And if you're watching us live on YouTube or Facebook, glad to have you on board. You can learn more about the show by visiting us at UroPatient.com, the best place to go to learn more about our show. Also, you can find all of our past episodes. Remember, this was created for you, the patient out there. I also created all these helpful handouts. Every time I have an episode, I've got a handout to go along with those episodes. You'll find them helpful. Check them out at any time. They're there for you guys. So at this point, we're going to switch gears here and go into the vacuum erection device. The history of the vacuum device, 1874, the first clinical application for a vacuum technology for erectile dysfunction. Didn't really work too well because it wasn't until 1917 that Dr. Lederer combined suction and compression. So that's really what's necessary. So you can make the cavernosal bodies erect by external vacuum pressure, but it won't stay erect. So you need something to kind of clamp down and stop those veins from letting the blood drain. And so that's what he came up with. Interestingly, though, from 1917 to 1970, the device was barely altered. It really wasn't utilized much. Nobody kind of did any great studies and changes to the device. So it either was so good or so bad, right? So external vacuum therapy really kind of got its kick in the butt by a guy by the name of Gettings Osborne, who was using it to treat. He kind of dug up that old patent and dusted it off and did some updating to it and created what he called the erectate system and formed this company that would produce the erection device that we currently all know, the vacuum erection device, which was a pump and tension rings to help maintain an erection. And it was in 1982 that the U.S. Food and Drug Administration finally granted permission for the VED as a prescription product. So when these first came out, and they're no longer prescription, they're over the counter. But when they first came out, these things were all prescription only. Now, I entered the urology profession in, I think, around 85. So, it's just a little bit after this had gotten its go ahead into the become a prescription device. And I can tell you that I got recruited by my group to actively start, helping patients that were interested in it and how to use the device. So I got a lot of hands-on experience. And again, that's what I say. That's what we bring is hands-on experience. So in 1980, Weatherington and Natick and then Lou in 1990 basically kind of helped push the device's usefulness to gain recognition. And in 1991, it was the most prescribed treatment for ED. Remember that the pills didn't come out until much later. So it was the king, And I think if you think about it, if you go to a patient and you said to him, well, you've got an option. We can, do a surgery, put a penile prosthesis in, or you can use this little suction device and you'll get an erection that way. Most patients are going to want to at least give that a try. And most of our physicians always would recommend try the vacuum device. If you don't like it, then we can talk about the penile prosthesis. What were some of the advantages and disadvantages? So advantages, it's quick to use. Normally an erection will occur in a few minutes. They say increased spontaneity. I don't ever try to tell patients there's any spontaneity. You're going to stop and like Arnold Schwarzenegger, I'm going to pump you up. It's not something that you can just kind of spontaneously use. You can't hide the fact you're using it. It's a pretty obvious device, but it works. It's reliable. When taught properly, I would say that, there's probably 99% of the patients that can get an erection with it. Now, so it's easy to use. Again, some tricks to it. I will tell you that we're going to go through some of those. Totally non-invasive, that's for sure. Can incorporate into foreplay. The most success I've always told patients, make this part of your whole foreplay. If you incorporate it, it's going to be a natural thing to do. You're just going to get going. It kind of gets some blood flowing to the penis, which is always good. If you take a totally flaccid penis, it's harder to work with than if it's partially erect. So if somebody's getting a little bit of an erection ahead of time, it's a big plus. One-time cost. Now, back in the day when these first came out and they were prescription only, I believe they were $500 a piece. And I'll go over some of the pricing now and some differences in what you can get for the money for the over-the-counters, which are still the same product, just much cheaper. But yeah, they were kind of expensive back then. But I can tell you, we used to buy them in lots because we got a discount to get them in bigger amounts. Few contraindications, priapism, if they have a known history of that, or significant bleeding disorders. And I would even go as far as to say that you can use it with patients that are on blood thinners, but you better do a lot of teaching. They have to use it carefully. You can develop a pretty serious hematoma on the penis from a vacuum device. And that's the scary thing. Usually not a bad, something that won't go away, but it gets patients pretty nervous. Disadvantage, instability at the base of the penis causing pivoting. So that's the one problem with the normal erection. Part of the erection is back inside the body, but the bands are always at the outside, the exterior of the body. So trying to show that. So what happens is at the point where the bands are, the penis can pivot. So they have to kind of sometimes hold it to it, insert it, and just understand that it can pivot at the base. Usually once it's inserted, it provides a good erection for intercourse, satisfactory for both couples. With a few exceptions, they need to know that it's going to be a little bit bluish and cyanotic and a cool erection. Some of the partners have said, yeah, the penis feels a little cool to me. Perfectly normal, not to worry about it. The inability to ejaculate is due to urethral obstruction from the bands that you're wearing. We'll go over those bands a little bit. You'll see that. Pain due to suction or constriction. Especially some patients are just, they're gung-ho. They put their penis in, they want it fast as possible, and they pump it up as quick as they can, and the results cause a lot of discomfort. Petechiae is pretty common, 25 to 39%, especially if they're on like daily aspirin or something. You'll see these little dots. That's really not a contraindication to using it. I normally tell patients wait till it clears up before you use it again and be more careful with how fast you pump it up. Bulky, indiscreet, and messy with lubricant. So, I mean, you have to use a fair amount of lubricant to form good suction. And so for some patients, it gets to be a little bit of a daunting task, but usually I've never had a patient complain too much of that. So here's what the device looks like. This is the Encore device. So it's the cylinders. These are the bands that's shown here. And this is, get the picture out of the way. The actual vacuum device. That's the quick release that this one has. This is one of my favorite ones, by the way. It's the Encore. Comes in 3 different models, the battery operated and 2 manual ones. So this is going to show you how this works. So this quick release valve is placed or release sleeve is placed on the vacuum device, and it's got a loading cone. Put a little lube on the cone. This is the hardest thing for most patients, is to get that band on the vacuum device. So you have to preload the band so it's able to be snapped off right away. And then this is the vacuum erection with the electric device. So it's a battery operated suction device. Something they came up with. I think it's not a bad idea. One of the problems is if you don't get a good suction around the penis, it won't work. So they got this rubber gasket sort of device that you can put up against your body. Sometimes you can use less lubricant that way. But the whole trick is then you push the button, and this button has to be held. That's not the way exactly how they show it, but you hold the button so that you're controlling the amount of vacuum pressure. I tell patients till it gets uncomfortable, don't overdo it and give it time. Not as fast as this guy in the demo shows. So there he just pushed off the band. This is, they call it the one-hand manual pump. I kind of like the manuals myself. I just think that they're more reliable. You don't have to worry about, if your battery's not charged, you're not charged either. So this is a 2-hand model, both easy for patients to use, dexterity. Once you obtain the erection, that extra piece is removed. You don't need that on during intercourse. And then you do wear the band around the penis to maintain the erection. So that's why if you ejaculate, there may not be any semen coming forward until you pull that band off, then it'll just drip out the front. You should never wear the ring for more than 30 minutes at a time. You can tell them you can have sex every hour if you want, as long as you take an hour off in between and not leave it on for more than 30 minutes. So lots of choices out there. This is Amazon's website. And the most expensive one, I just kind of wanted to get a variety, was $200. Remember, it was $500 when it was FDA device approved, but for the low cost of $200, you can get the Augusta model. The Encore model, the one I demonstrated, which I kind of like, they actually give you a combination of the electric and the manual. I think that's a pretty nice way to do it. So you get the whole thing for $125, and it includes the bands you need. We'll talk about that, a DVD on how to use it. Plus, I like that quick release mechanism. I'm going to show you that in a little bit. But patients can get it for as cheap as $37 for a electronic model. It's this Amazon's bestseller. And then $12.99, this really El Cheapo with this manual device. Now, I will warn you about what's the differences. So I recommend to patients that I would go with the Encore device. And the big difference is the amount of vacuum pressure that these things can create. This one and this one are not very regulated pressure systems. So as hard as the patient can pump it, and probably too hard sometimes, they can build up a lot of pressure. All devices have a release mechanism. So if you overpressurize it, you can push a button or let the pressure out. But again, I get a little worried with these, I guess you get what you pay for, right? These two devices I'm a little nervous about. I would recommend at least spend $125. I don't see a big advantage of the Augustus system. It has nothing that the other ones for $125 or $75 less can offer. But the truth behind it, excuse me, is it's all about the rings. So most of these vacuum devices will get you an erection. It's how you maintain the erection and what's comfortable. Some of the rings are not very comfortable. Some are not very good. So I like this particular set. It's a silicone, and you can see they come in all different sizes, and you have to figure out what size works best. I always start with the biggest diameter one, and then which would be this one, size 3, then work my way down smaller until it's strong enough to hold the erection. And patients, you have to experiment with this. You need to start off, don't even use the rings, just kind of practice getting the erection. After that, start with the big ring. Does it hold it? Nope. Next time, give it an hour break, try it again, or next day, next event, try it again, use a slightly smaller ring. I really like this kit. It's a little pricey, $110, but it gives you a big variety of ring choices. And I think that you're not going to find one ring that everybody's going to have a great success with. But I think this will give you, and you can see that some of these are smaller inner diameters. And I can tell you some of these small ones are really tough to get on that cylinder beforehand. So these are all 4 different types of materials, silicons, and I don't know what this other one's made of. But I think for $110, it's not bad. Otherwise, there are all the devices come with some of their own bands. So you can try and see what they come with. Now, Tim Medical, as part of the Osbon, came up with this Erectate erection tension rings. And what they did is they put these 2 little bumps here. Those are supposedly to compress the veins so that they don't leak blood out. So that's the bumps there. And then underneath here, they made an opening to relieve pressure. And their claim to fame is that you should be able to ejaculate through that. I can tell you that I've worked with the bands with patients, and I don't think they're as efficient at preventing the blood from just leaking out, so they don't hold the erection as well. I haven't had any patients say they noticed better ejaculation with them. And I think those bumps sometimes make them uncomfortable for patients. So I'm not a big fan of them, but it's out there. You're not the one using it. Give the patient the options when you're teaching about it. And then this was a set I saw. I'm not even sure about just looking at how bulky that is, how good it would work. But I think the idea behind it is it's a seal that'll form around the vacuum device, and then the inner ring is built into it. So I think some patients have trouble pushing that ring off. So this might be something that works for them. So you have to have lots of options. this is not something that you just tell the patients, go to Amazon and order it. My way that I like to do it is I would tell the patients, go to Amazon and order this particular one. I would give them a printout of it to take home and then make an appointment to see me and bring the device in. We're going to go through it step by step. I always say that 5 minutes with me is worth hours and hours of struggling with the instruction sheet. And I've had really good success with patients, but I think it's something that you need that training and then the expertise. You know, here's his struggle. I go, well, let's go and order these. Let's see how that works, because you can't push that band off. And then, as I said, it's always best to start with the largest diameter and then work your way down. I've gotten to the point where some patients have to use 2 bands, and that's acceptable, long as it's, you know, it's holding the erection. That's the main thing. So some patients will have to have tighter. Most patients don't. I usually find most people kind of fall in this middle of the road type bands, like right around here and here. Very few have to wear the smallest. Very few have to wear the biggest. Now, if you ever really wondered if I was an art major, here's the answer to that question. When I was trying to come up with, I couldn't find anything on the internet. A problem that's real common that I see, and it's frustrating for patients, and it's the penis gets actually kind of like bent on itself as the pump. So you're pumping your penis up, it's flaccid, so it just kind of drags along the surfaces. It's starting to enlarge, and at some point it'll probably get caught and start bending over. So the bodies are still filling, but now it's bent in half. They're not going to get an erection if their penis doesn't get fully erect. They have to get all the blood they can into it. So I come up with what I call the double pump method, or the break, shake, and reinflate. Now, what I mean by that is you pump it till you start seeing it, you know, bending, and you still have some blood in the penis. Then you break the seal. So you go ahead and push that button to relieve the pressure. You want to literally, sorry if I just hit my mic, literally shake the device up and down to get the penis to kind of lay flat into the device. Sometimes if you're having a lot of trouble, put a little lube on the tip of the penis so that it slides better, but you want to shake it down into the cylinder and then go ahead and reinflate it. And it'll then get fully erect. It really saves again, that's why I say 5 minutes with me will save you an hours of frustration, because I can see what's going on. I know where the problems are. I'll warn you about it. The other big thing is patients are not patient. They start to see the penis get erect. They're ready to go. So what they do is they start to inflate it. It's a little bit erect, and they want to pop that band off. I tell them, you've got to make sure you have 100% erection. So the way you can judge that is while your penis is in the cylinder and you think it's erect, give it a little bit more suction. So if it's the button for the electric or in the pump for the hand, give it a little bit more and watch the penis. If it increases in girth or size, then give it a little more time. Most patients, like I said, they in 1 2 minutes, it looks like it's erect, but it's not. You have to trap the maximum amount of blood. Otherwise, you're going to get an erection that when it comes out, it's going to be half erect. So you've got to have 100% filling. So encourage them to take their time with it. And then this is the most important thing. You have to push the band off quickly. You've got to get all the band off of the cylinder, and it's got to completely come off before the seal breaks. Because once it clamps down on the penis, you'll hear the suction of, the rush of air coming into it. Rarely, depending if somebody has a pretty good sized penis, they're going to have to release the vacuum with the push button. But most of the time, it's going to break the seal. So if you get like half on and half off, I've seen that a lot, they're going to have a half an erection. So this is why I like this device so much, this little twist thing right here. So when you twist it, it pushes on both sides of the band, or 100% of the band, all the way 360, and shoves it down to get it seated before the vacuum breaks. Really, really works well. And it's so easy to use for patients. That's the best part. So here's another one of my artistic drawings. I couldn't find a good picture, so you get my nice drawings here. So this is the penis inside of a vacuum device. And we got to remember about the scrotum, because it's right down there too. So I always tell patients, grab a hold of that thing and pull it down, especially when you first start suctioning it. Because if not, I've seen this happen, and it's not a good thing. you can pull a testicle right into the vacuum pump, and it's very uncomfortable. I mean, you can imagine it's pretty uncomfortable for patients. At that point, break the vacuum, restart it. But if you tell them to grab their sack and pull it down as they're vacuuming, that's why I like the electric ones the best, because it's got a one hand or that one-handed manual one, so that you can pull with one hand, vacuum, get it started. Once it's kind of set and started and the vacuum is well established, it's not an issue. And then these things here help to make that inner diameter narrower. So if you are getting a lot of trouble with the scrotum falling in, make sure you put the reducing rings in. If it's too small, it'll be hard to get off. So make sure you start big and then work your way down. So tips and tricks. Best using standing up. Trim or shave pubic hair. Gets in the way. Use plenty of lube. I always say put it like you're putting toothpaste on your toothbrush, a ring around there. Keep the lube off of the scrotum. Otherwise, it makes it easier for the vacuum to suck it in there. Be patient. Huge. Got to be patient. Only pump until slight discomfort. Don't go crazy. Some patients are just they're bumping and pumping and pumping, and you just tell them, hey, easy. It's the pressure that's doing the work, not the pump. So they should never use it if they're having, they notice their skin is broken or bruised. The vacuum device has found its way into some after prostatectomy penile rehabilitation too. So use of drugs or devices can help maximize erectile recovery. They think that, by getting that continued blood flow and tissue oxygenation, it can prevent smooth muscle structural changes. So we can advise patients to do a penile rehab with a vacuum device. No rings necessary. All you're doing is just getting it erect. Use daily for about 10 minutes without the tension rings. So I hope you enjoyed this episode. We'll see everybody next week on UroPatient.com.